Hi and welcome. My name is Jeff Sherwood and I am a member of the TRE team. Welcome to this training, which is entitled Introduction to Trauma-Informed Care. The goal of this training is to develop a common language about trauma-informed care. As step-by-step moves forward in our transformation to be trauma-informed, resilience-oriented, and equity-focused, the first step is to develop a basic understanding of trauma-informed care. It is also important that our staff are aware of the words and language as it relates to trauma-informed care. This training will begin with defining what is trauma and what is stress and how stress may relate to trauma. The training will also discuss what trauma-informed care is and what it is not. In addition, this training explores the principles of trauma-informed care and its framework. So let's get started. It's important to begin with defining the word trauma. For many people, when they hear the word trauma, they may think physical injury to the body, whereas others will think about psychological and emotional harm. Let's uncover this topic. What is trauma? Trauma can be a single incident. Trauma-informed care is really built more on individuals who have experienced what we call complex trauma. Complex trauma is defined as the exposure to multiple, often interrelated forms of traumatic experiences, and the difficulties that arise as a result of adapting to or surviving these experiences. Trauma can also be interpersonal violence. A violation at the hands of an authority figure or a trusted figure can be especially challenging. The Substance Abuse and Mental Health Services Administration, or SAMHSA, talks about trauma through the 3 E's: events, experiences, and effects. This can be helpful because it's often easy to remember. The event, again, can be a single event or multiple events. When a person is exposed to a traumatic or stressful event, how they experience it greatly influences the long-lasting adverse effects of carrying the weight of trauma. These effects can include changes in neurobiological makeup and difficulty coping, feeling trust, managing cognitive processes, and regulating behavior. The 3 E's will be further discussed later in the training. Remember, a particular event experienced by one person as traumatic may not be for another person. Everyone's perception on events is individualized, and thinking an event shouldn't be traumatic doesn't mean it isn't. Our experiences in life are highly individual. As our agency begins to move forward in our transformation to be trauma-informed, resilience-oriented, and equity-focused, it is important to acknowledge and think about: how do you define trauma? How does society define trauma? How does this impact you at work? This list is just a few examples of trauma. The goal of trauma-informed care is to widen your lens and increase your awareness of what trauma is. Often trauma occurs in a subtle way we may not even be aware of, such as through implicit bias or systematic trauma. The agency's TRE transformation increases our opportunities to heighten awareness of those types of trauma, as well as the things we may be desensitized to because of our personal experiences. Now, it's important to know that this is not a complete list of traumatic events. In addition to the use of the word trauma, one may hear the words toxic stress used frequently.
Hello, my name is Lori Kivler, and I am also a member of the TRE team, and I will be guiding you through the next few slides. Another word we want to talk about is the word called stress. We want you to invite this word into your vocabulary around trauma because you're going to often hear trauma, toxic stress, and adversity, and they may be used interchangeably. So let's talk a bit about stress. There are really 3 types of stress. Please keep in mind these are quick and simple definitions. There is positive stress. Now, positive stress is something we all need. It's part of our healthy development. It helps you move through things. It helps you get through something you must do. Think about if you have to meet new people for the first time, or if it's your first day at a new job, or if you're a little bit nervous about a project that needs to be completed. Your heart rate may be a little different, your breathing is a little different. That's positive stress. Tolerable stress is when stress hormones and chemicals become severe enough to change your brain architecture. So you're now having trouble sleeping, you may be having a hard time thinking clearly, or you can't make a decision very well. So the stress is severe enough to change your brain architecture, but it is buffered by a supportive relationship that allows you to cope. Let's think about this for a second. When might you experience tolerable stress? If you hear really upsetting news about someone in your life, if you hear about someone in your life that may have a serious illness or injury, or if your workload is overwhelming, you might be experiencing tolerable stress. Then there is toxic stress. Toxic stress is when tolerable stress is there but doesn't go away, and you don't have any coping skills to help you. This is severe enough to change your brain architecture. It is prolonged over time, and there is inadequate buffering and protection through relationships to help you cope. Why are we asking you to think about this concept of stress? One reason would be because some people don't think they have trauma, but may very well be experiencing toxic stress. And what's important is that toxic stress has a similar impact on your wellness as experiencing trauma. Secondly, we can often be that buffer for the individual or a protective relationship that can help someone move out of that tolerable stress and avoid toxic stress. What does trauma-informed care mean? A program, organization, or a system can be trauma-informed. Notice, we are not stating individual, family, or group. Trauma-informed care is about organizational change and system change. A program, organization, or a system is trauma-informed if it realizes the widespread impact of trauma and understands potential paths for recovery, and recognizes the signs and symptoms of trauma. This can also include recognizing stress, toxic stress, and adversity. So we're going to realize the widespread impact, we're going to recognize the signs and symptoms, and then thirdly, we're going to respond. Next, we're going to give you a couple of different frameworks as a way to think about trauma-informed care as we're building this common language. Now we will take a look at how SAMHSA explains trauma-informed care. In the next few slides, we will break down each concept of trauma-informed care. Events can occur as one single occurrence or repeated occurrences over time. These events may include threats or actual physical, psychological harm. Experience with these events helps the individual to determine whether or not the event is traumatic. One event that is traumatic for one individual may not be traumatic for another individual. Each individual is the judge of what they consider to be traumatic. Events are typically long-lasting and adverse. Adverse effects may appear immediately or have a delayed in onset. The effects can be short or long-term. The 4 R's of trauma-informed care are a crucial part of becoming trauma-informed. The first R stands for realization. Realization when relating to trauma-informed care means realizing that there is a widespread impact of trauma and that there are potential paths for recovery. The second R stands for recognizing. This means recognizing signs and symptoms of trauma, not just in the workplace, but also in family and friends. The third R stands for response. This means responding by integrating knowledge about trauma. The final R stands for resist re-traumatization. It is very important to ensure that while practicing trauma-informed care, not to re-traumatize someone. The 6 key principles of trauma-informed care. Physical and psychological safety is essential. All decisions are conducted with transparency. This helps to maintain trust within relationships. Having people with lived experience, similar trauma, can promote trust, safety, hope, and healing. Collaboration and mutuality are used to treat everyone with respect. The voices and opinions of others should be taken into consideration to make others feel heard and valid. No stereotyping is done based on another person's gender, age, race, background, or culture.
Hello, my name is Devin Crisanti and I am a member of the TRE team. I will now guide you through the remainder of this PowerPoint presentation. The 10 implementation domains for Step-by-Step Incorporated. Governance and leadership. The leadership of the organization is implementing a trauma-informed approach. There is an identified point of responsibility for overseeing that this trauma-informed approach is carried out. An agency employee with knowledge of trauma-informed care is in place to initiate a system change. Policy. The agency has written policies and procedures that reflect a trauma-informed approach within their work. Physical environment. The environment of the agency ensures that the physical environment promotes safety and collaboration. The setting of the agency is safe, inviting, and poses no threats. Engagement and involvement. The agency takes everyone's thoughts and opinions into consideration. The leadership team takes time to make sure that all voices are heard and valued. Cross-sector collaboration. While trauma is not the sole purpose of the agency, it is cross-referenced to ensure that the agency displays trauma-informed principles. Screening, assessment, and treatment. Practitioners are trained and implement evidence-based practices that are culturally appropriate and trauma-informed. Trauma screenings and assessments are implemented within the agency. Training and workforce development. The agency continues to learn and train staff and individuals served on the most up-to-date trauma-informed care principles. Progress monitoring and quality assurance. The agency monitors the trauma-informed practices to ensure that they are implemented correctly and maintained. Financing. The agency uses financing to expand their trauma-informed principles. The finances are used towards staff training, staff development, peer support, environment, etc. Evaluation. The agency measures and evaluates the success that comes from using trauma-informed principles. What trauma-informed care doesn't mean. Trauma-informed care assures that emphasis is placed on not excusing or permitting unacceptable behavior. The best way to recognize and start to heal from trauma is for individuals who created the trauma to be accountable and take responsibility for their behavior. We want to support our individuals by looking at how trauma has affected their life, not just from a behavior perspective. Trauma-informed care emphasizes using compassion and support as a means of understanding trauma. Support should be real and authentic, not mushy or fake. Trauma-informed care recognizes the value of building on existing strengths and not focusing on only addressing negative behaviors. Trauma-informed care empowers individuals to recognize their trauma and utilize skills to cope with the trauma. The key to success with trauma-informed care is not just to look at it as just training information. Well beyond this training is the focus of how trauma can affect each individual and how focus on resilience-oriented strategies and equity will foster greater self-awareness and self-care. Beyond the individual emphasis, business and society can benefit by identifying wellness policies or procedures, as well as looking at physical environments that could aid the workforce. For example, employers could have areas of the business where individuals could go if experiencing stress. In closing this training, the hope is to recognize the benefits of initiating and maintaining trauma-informed care practices will leave an indelible proactive impact on all individuals' lives and help our society to be more mindful of the impact of trauma, being resilient, and the power of equity. We would like to end our training by focusing on how Step by Step Incorporated strives to be an agency that recognizes the effects of trauma and provides our individuals and staff with the resources to better care for themselves.